I'm also, and my colleagues, passionately against certain restraint and seclusion procedures, not just because of data and evidence, but also because other evidence are the views of the people that we support. In the last 30 years, I've been really privileged to learn from individuals, not just with a diagnosis of autism, but other conditions, who have been victims, and I'll use that word strongly, victims of restraint and seclusion in services. And this is across the world. One of the things that's really important as a researcher is that we mustn't dismiss people's experiences and views as if they're just an hors d'oeuvre, and the main course is hard data. What people say is data. What consumers' views are is data. I was reminded of a study fairly recently, I think it was published in North America, where they looked at the views of nursing staff in a mental health establishment and their patients about restraint. What was interesting to me was that both groups actually said that they didn't quite like applying restraint methods, but both groups also had very divergent views on their reasons. And I think one of the things that we need to do in the future, and I've certainly put it in my book and it's grown in our work, is that the views of the people we support are central to the work we do. To give you an example, more recently, I've just read a book by a woman called Alexis Quinn, who was a former Olympic athlete in this country, who was later diagnosed with autism. Alexis is a very inspiring speaker. She's incredible when she talks passionately about her experiences of being institutionalised at one point in a mental health establishment. She's written a book called Unbroken, and I'd recommend that people read it line by line. Each line shows a measured response of someone who was in a state of chaos, who couldn't understand why people were actually being quite controlling and coercive towards her. And I think one of the things about this is that often we see the world from our own point of view. And I think the views of consumers and experiences are here to stay. They're not an hors d'oeuvre. They're not an afterthought. We need to understand that our world is changing. In my field, we call it the neurodiversity movement. Call it what you like in other fields. But the voices and words and experiences of people are saying, don't do this to us. Find other ways. Find alternatives. Distressed people do not learn by people laying their hands on them or people isolating themselves in a room, no matter how well intentioned they are.